Today we talk about comparing yourself during fertility treatments. It's a common, natural tendency to compare yourself, but it's not always beneficial. I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. We all compare. It's a natural part of being human. Whether it's our jobs, our homes, our relationships, or even our journey to parenthood, comparisons always find a way in. When undergoing fertility treatment such as IVF, this comparison is often magnified. And it can be tempting to look at others' estrogen levels, their dosages, or even their outcomes and stack them up against your own. But the truth is, it's like comparing apples to oranges. It's easy to think that we're all humans, so everything will be the same. But fertility is a little bit different. Think of it like a marathon, I've stated before. Each person's fertility journey is not a sprint, but a marathon. And just like every runner, they have their own pace, their rhythm, and their strategy. So whether one person is behind or one person's ahead, in the end, the goal here is getting to the finish line. So in fertility treatment, the finishing line is having a pregnancy. So regardless how bumpy the road is or pace we're going or who's ahead of us, don't lose sight of the goal, which is pregnancy. However, even knowing this, it's easy to compare. One thing that people compare are their estrogen levels. For example, while it's true that estrogen plays a crucial role in IVF, comparing yourself doesn't make a lot of sense because you have to know a lot of things about that patient if you're going to compare yourself. For example, let's say your friend has an estrogen level of 2,000 and your estrogen level is only 100. Well, you can easily feel like things must be wrong. My estrogen level is lower. And that's not an unreasonable thing to think. But in reality, if your friend is on cycle day 8 or 10 of her cycle, and you're on cycle day 3, that's a big difference. Her follicles are bigger. Her follicles are going to have more estrogen. On the same token, there are some people who start off very slow. And so even if you're comparing the same day and you think, well, wow, why is my day 3 lower than hers? If your body are one of those people who stimulate slower and then go up, you may be making more eggs than her, but your estrogen level may start out a little lower. Even certain priming agents we use can cause the estrogen level to start a little lower. So one of the things that can happen is by comparing yourself, you can cause fear. And that fear may make you think that you're not doing as well, when in reality, you're doing just fine. Another example of this comparison is comparing medication doses or protocols. Not one size fits all treatment type of approach when it comes to IVF. Higher doses doesn't necessarily mean a better outcome. So for some people, we use higher doses because they need those higher doses to get the same amount of eggs as other people who can use lower doses. If you were giving the higher dosage and it wasn't correct, it would put you at higher risk for things like ovarian hyperstimulation syndrome. In the end, different people require different dosages. Just as different recipes require different amounts of ingredients. They may be the same ingredients like salt, but a little bit too much of one can ruin another. Well, the same thing happens in fertility treatment. Sometimes some people need more of a certain ingredient. Sometimes they need less. Don't let it worry you that your recipe is not the same as your friend's. Another situation is people compare how many embryos they get. Well, my friend, she got 12 embryos, but I only got 5. Now, you have to compare things in the right view. Did they do PGTA testing? So maybe your 5 are all euploid, but hers are not tested. So that's why she has more embryos. Or the other situation, where did she start with? Maybe she makes more eggs than you. And so for that reason, she's going to have more embryos. It also matters where you're coming from. Someone who has 10 years of infertility and has endometriosis is not going to get as many embryos as someone who has a vasectomy and is just doing IVF because of the vasectomy or even for gender selection. So again, it's important that it's normal. You're going to compare yourself. No one's going to not compare themselves. But you really have to look at everything. You have to look at it from the standpoint of, is it the same situation or is it different? Every person starts at different points, but we're all going for the same goal, a live birth. So is it horrible if you compare yourself? No. Again, I'm not going to tell anyone not to compare themselves. I just want to make sure that people understand that you're comparing, but if you don't truly understand what you're comparing, you're making conclusions that are incorrect, and you may stress yourself out. And comparison, when you lead to stresses and anxiety, these are not conducive to fertility and your overall well-being. So it's easy to feel discouraged when you're comparing yourself because someone's going faster or maybe they're getting more eggs. But in the end, our journey is to get pregnant, and your journey is your own. And so instead of stressing yourself out and comparing yourself, in the end, ask yourself the question, did I have success? And if you didn't, then that's the point where you compare. Then you say, why did mine not work? This person did this. Is this good for me? And then you talk to your doctor, and your doctor can let you know if that treatment would be good for you. It may not be, but it's not unreasonable to ask. But while you're going through your cycle, unless you truly have a good grasp of the comparisons, it's probably going to cause you more stress. And although stress isn't going to make you not get pregnant, it's definitely not going to help things. And IVF sucks. It's already stressful. You don't want to add more stress to it. I think one of the things to keep in mind is everyone has the same goal in mind. Your fertility team wants you to have success. There is no sinister doctor out there saying, oh, I'm just going to pretend to get these people pregnant. It just doesn't happen. Everyone is trying to get you pregnant, and you need to trust your fertility team. And so when those questions come up, when those comparisons happen, which they will, you are human, it's important to talk to your team. Get the reassurance you need to make sure you feel comfortable. But remember, everyone's goal is the same. Every doctor, every person in that clinic wants you to succeed. No one is holding back anything. It doesn't mean doctors are perfect. It doesn't mean that they can't give the wrong protocol and that they, hindsight, go, I probably should use this different protocol. No one's perfect. But in the end, what I can tell you is no one is really going to be malicious. Everyone there is wanting you to get pregnant. And that means everything they do is always to give you the best chance. It's like baking a cake. Each person requires a specific recipe with its unique amount of ingredients. And even though the amounts may vary, in the end, you still have a beautiful, delicious cake in a live birth. In the end, ask questions. Stay informed. Remind yourself that your journey is uniquely your journey. Take comfort in the shared experiences, but avoid falling into the comparison trap. Don't stress yourself out more than you need to. Comparison is a natural tendency. Your job is that when you get to that point, ask questions, stay informed, so that way you aren't comparing the wrong things. In my experience, the most common things that get compared are going to be the estrogen level during stimulation, the protocol that you're on, how many days you stimulate, and then the embryology portions of how many eggs you get, how many fertilize, and how many make it to blastocyst. Now, as we talked about with estrogen levels, it's very difficult to compare people. Even the same person with the same protocol could have different estrogen levels at different spots. The purpose of the estrogen levels are purely to help us take the images that we're seeing in the ultrasound and define them better. If we see lots of big follicles but the estrogen levels are low, we know they're not mature. If we see very high estrogen levels and the follicles are a little bit smaller, we may realize they're mature than we think. When it comes to protocol, as I discussed, everybody's different. Your protocol is your protocol. If you have questions, speak up and ask. Make sure you feel comfortable with it. But don't be worried that your protocol is not like someone else's because maybe you didn't need what they need, or maybe you need something they didn't need. A lot of people get worried about if they're stimming too fast or stimming too slow. I don't get too worried about that I've seen success with people who have stimulated for 12 days. I've seen success with people stimulating only 8 days. Everybody's unique. Now, in average, sure, most people are 10 days plus or minus 1 day. But being 8 days or 12 days is not considered a death sentence that is not going to work. So don't be worried about that you didn't trigger the same time as your friend, even though you started on the same days. For some reason, there might be a benefit for waiting 1 extra day for them. Maybe they're doing PGT and so they need an extra day because they have sperm issues. The point is the day you get triggered isn't just a number. It's based off of things like the follicle size, based off how many eggs we're expecting, based off if we're doing ICSI or not, and based off of estrogen levels and other things. When it comes to the embryology lab, it's a little bit different. Every person's unique. For example, women with polycystic ovarian syndrome get lots of eggs but get very few embryos, and that freaks people out. As I talked about in my last podcast, you hear about a woman who had 30 eggs and only got 2 embryos, I would be scared too. But you need to know that she had polycystic ovarian syndrome, which meant she had more inflammation in her body, which caused a lower attrition rate in that situation. She got fewer embryos. But someone who doesn't have PCOS, they may only get 8 eggs, and they may be freaking out that they're not going to get anything and can still get 8 embryos. So when you're comparing yourself in embryology, it's really important to know the details. If someone only gets 5 fertilized, that sounds horrible. But when you find out of the 12 eggs they had, only 5 were mature, well, actually that's perfect. That's 100%. So it's not as bad as it seems. Versus the person who has 20 eggs that are mature and only gets 5 fertilized, that would be a bad fertilization. In the end, the point is, you are unique. You are your own person. And that means you need your own protocol. And that means the adjustments to your protocol are going to be different. Even people who are identical would have completely different stimulations because it's not just about being human. It's about your situation. And your situation means you started at a different point. Your situation may mean your egg quality is different. Your situation may be that there's a sperm problem that we have to keep in the back of our mind. The point is, IVF sucks. IVF is stressful to begin with. There's no reason to make it worse. So in the end, if you're comparing yourself, which you will because you are human, you're going to speak up for yourself. You're going to ask questions to your doctor, and you're going to make sure to reduce your stress and have a successful IVF cycle. As always, I greatly appreciate everyone who listens to the podcast and who tells people about it. If you like it, please give us a 5-star review on your favorite podcast medium and tell your friends about us. As always, please feel free to send me topics that you want me to do either through Facebook or Instagram or even email tbft@newdirectionfertility.com. I look forward to talking to you again next week on Taco Bout Fertility Tuesday.